Welcome to the 3-Minute Whiplash. What can you do to help video? I'm Dr. David Warwick, your local Lacey Olympia chiropractor. Whiplash is essentially a rapid whipping of the head back and forth, and it's called WAD, or Whiplash Associated Disorders. There's actually 4 categories that it's in. Category 1 is WAD I, is where there's pain but no type of physical exam type findings. WAD II, or the second category, is when there's exam findings but no nerve or neurological type findings, which would include like numbness or a weakness. The third one is loss of neurological function, and the fourth is actually a type of fracture and dislocation. So first, continue with your usual activities, but that's usually what you like to see, because that contributes to the rapid or better recovery. Some of the symptoms, when they're more severe, we're talking about the best options are mobilization and manipulation of the neck and the back for effective therapies. But here's some easy self-help things that you can do. Here's an easy acronym that we use. It's called PRICE. Protect, rest, ice, which can include heat, compression, and elevation. So the protection is stay with your daily activities as much as possible, but avoid sharp pains that may be affecting you throughout the day. Rest it, well, that's just being aware of what's, using your common sense and good guidance. Obviously laying around may not be always the best option. Icing, well, I've done a video on this, and icing essentially reduces the swelling. When you use heat, it draws in fluids. I would say that would make it worse for your condition. Compression, well, you can't really, if your neck's been involved, you can't really wrap your neck, but those are things like your ankle and wrist and elbow that can be wrapped, or a brace can be used. Elevation, same thing. This tends to be for more of an extremity in helping with that type of symptoms. And last, there's 2 suggestions of things that you can do, and that's range of motion. Especially, let's talk about your neck. Move within what we call a reasonable pain, or reasonable boundaries with pain. So you can move your head forward, backward, tip it to the left and to the right, and even turning your head to the side. You can do that with even a little bit of light resistance by placing your hand or fingertips to the side and pushing into it, or pushing in the direction that you want to move. That will help it as well. And last but not least, I've included this on many of my other videos. It's the chin or head glide tuck, by simply moving the head backward, extending that chin like almost on an even plane, to get those neck flexors to start contracting and strengthening, and bringing that head into a more normal position. So I hope these little tidbits helped you out, especially after a whiplash type injury. I'm Dr. David Warwick, your local Lacey Olympia chiropractor. Visit my blog at drdavidwarwick.com. Thank you for watching.